Today on Business Daily with me, Sam Fenwick, the latest episode in our Million by 30 series. I'm joined by Elwinder Singh. Elwinder founded his company, Connect and Heal, in his early 20s. It's a private healthcare enterprise that coordinates appointments, tests, treatment and medication on behalf of other businesses for more than 6 million of their employees.
How do we ensure that every single patient that we currently cover has access, is able to have a wow experience, and at the same time we are potentially able to improve their health outcomes?
Elwinder tells us what prompted him to come up with the idea, why he moved to India to get it off the ground, and tells us how he hopes to continue growing his business.
So much to do in this space. The speed of digitization, the use of digital therapeutics, the use of big data in healthcare and wearables and so on and so forth, and the need to basically be able to track and affect the clinical outcomes.
That's a Million by 30 with Elwinder Singh. My conversation with Elwinder started with his family and how struggling to get good care for his dad started the thought process that led him to founding Connect and Heal.
We had multiple doctors treating him. Obviously, when someone has multiple lifestyle diseases, you would have to see various specialists, right? And unfortunately, we got a lot of conflicting advice. We were left on our own to navigate the entire testing systems. We were running from hospital to hospital. So extremely frustrating.
When you say your dad had lifestyle diseases, could you describe what they are?
Diabetes, where you have high glucose levels. He was a cardiac patient, so had some heart-related issues. And obviously, just trying to be physically fit, right, at the end of the day.
But a lot of those lifestyle diseases that you've described there will be experienced by many people of your dad's age, presumably.
Yeah, that's true. I mean, it's not just my dad's age, right? I would probably say that when we look at the data, we see like population segments who are younger and younger who are facing multiple disease incidences, right? And it's primarily because, as a population, we don't eat as healthily, we don't exercise as much, we don't sleep as much. So the basic things, right, are not being followed. And if you ever do need to manage your overall health in case you have a particular incident, how do you ensure that you have that access, right? And that's what we're solving. We wanted to make a change, right? We wanted to basically impact something that we saw that was not working in a very optimal manner. And this problem, whether in India, whether in Malaysia, where I'm from, or whether in any other parts of the emerging world, is fairly similar, right? In that patients don't really have a care coordinator that they can trust upon, right? To basically help them manage all aspects of their healthcare requirements, to potentially also improve those healthcare outcomes, right? So that's what we set about to build, and that's been a journey from the last 6.5 years till now.
So what exactly is a care concierge, as Elwinder describes his business, and how does it work?
So essentially what we do, we basically connect the dots for every single patient to help manage every single health intervention that they require. So whether it's primary care, which is essentially going to a GP, going to a specialist, whether virtually or in person, managing their preventive screening, which could be your a blood check, could be a diagnostic test, and so on and so forth. Managing your medicine delivery to ensure that you're getting the right medicines on time. Managing emergencies, whereby currently we run India's largest private sector aggregate network of ambulances to bring down the response time. So to manage emergencies from that standpoint, as well as from a bed availability concierge-based assistance that we provide to patients. So it's a combination of not just a virtual-based solution, but healthcare is a very high-touch element, right? So you need to have that physical infrastructure, you need to have that in-person element as well. So we manage the entire last-mile delivery of care as a care concierge, if you may.
To make sure he was in the best possible place to grow and develop his idea, Elwinder left his home in Kuala Lumpur, Malaysia, and travelled more than 3,000 kilometres to India.
We realized that India as a country offered us a very large opportunity, given the fact that the size of the population, the fact that I think it was a rapidly digitizing economy, and given the fact that healthcare infrastructure continues to remain fragmented, right, relative to countries like Malaysia, Singapore, and etc. So we thought it was the right sort of environment for us to to extend our solution. So after discussing, after coming up with a plan, we basically packed our bags and I moved to Mumbai from Kuala Lumpur.
And you didn't know a soul when you arrived?
No, I did not actually. So my great grandparents were from India, but I'm a third generation Malaysian. So we basically navigated it from scratch. But now I think India is home. So yeah.
I mean, it's a great place for startups, isn't it, India?
Oh, the ecosystem is fantastic, actually. I think there's a very, very different vibe. There's a very different pulse because there are multiple conditions that make it right? It's very similar to certain hubs that you have across the world, whether it's in Silicon Valley, whether it's in Israel, Bengaluru, within India, for example, where you have the right combination of talent, capital, and also large scale problems that can be solved, right? So I think it's the right ecosystem in that sense.
Working out the money came next.
So we were first generation entrepreneurs, right? We've never done a startup before. So we bootstrapped the business primarily because we wanted to ensure that before we go and raise capital, we wanted to ensure that we had the right problem that we were solving and we had the right product market fit, essentially.
Now let's just pause there for a minute. For those of you who don't know, bootstrapping means building a business from scratch without attracting investment or with a small amount of external capital. It's a way to finance a small business by purchasing and using resources at the owner's expense without sharing equity or borrowing huge sums of money from banks. So Elwinder was, initially at least, financing his startup himself.
Eventually, I think as we got a fair bit of traction, I think capital basically flowed accordingly. We've done a Series A and in 2020 where we raised with Base Capital, which is an Alibaba-based fund, and Celesta Capital of Silicon Valley. So they are, and so I think from a capital standpoint, it's flowed out primarily because we're solving a tangible problem, right? And I think investors do realize that.
And now, as we sit here today, I think the figures roughly are that you're helping 6 million people with Connect and Heal.
Yeah, we cover 6 million lives currently on our subscriptions. And these are micro subscriptions where we manage, where enterprises basically provide access to virtual health, telemedicine, and we essentially handhold the patient across every single health intervention that they require, be it primary care, preventive care, emergency response, home care, and various others aspects that they might require.
And how does that make you feel that you've got 6 million people kind of signed up to your healthcare system?
In hindsight, yes, obviously it makes us feel good because we've been able to show that we've been able to impact lives, right? But I think at the end of the day, we're a team that doesn't rest on our laurels, right? So for us, I think it's a hyper competitive environment within India. So it's important to continuously try to innovate so that we are always one step ahead, right? And one step ahead primarily to become the most patient-centric healthcare organization in the country. Because if I'm able to add value to a patient's life, I think everything else just basically flows out.
So what's next for your business?
So two parts, right? One is, whilst we are serving 6 million lives or so, we want to ensure that we are able to give them a 10 out of 10 experience. So we're basically ensuring that we are able to provide you that wow experience accordingly. So that's one aspect. I think the second aspect that the teams are hard at work on is to also develop a direct-to-consumer channel because obviously whilst we currently are a B2B2C model, I think eventually we are going to be a D2C model as well.
B2B is business to business. So at the moment, Elwinder's company sells health services to other businesses for their employees. B2C, which is the area Elwinder wants to move into, means business to consumer, so direct subscriptions essentially. But at a cost of $70 a month in a country where the average salary is about $400 a month, is it affordable?
We're very much focused on a particular segment that it clearly can afford healthcare, but is not getting the expected outcome in terms of what they're looking for, right? Primarily because the healthcare infrastructure is fragmented, primarily because There's very little interoperability of data between providers, and there's very little assistance that can be provided to help a patient, a family navigate healthcare, right? So there is a market where individuals are price insensitive, because at the end of the day, when it comes to health, you want that assurance, right? So I think that's a segment that we are actively looking out at.
What would be the average salary then for somebody to be able to afford, do you think, $70 a month for your service?
So I think let's look at our existing cohort, right? Our existing cohort spends within a family, they spend $1,000 on healthcare. So that's about $300 per individual within a household. And a lot of that, 65% of that is not covered by insurance. So it's out of pocket expenditure anyways. There is scope for this because, as I said, India is a very large country, right? So at the end of the day, you can't be everything for everybody.
In India, the pandemic continues to worsen, with more than 200,000 deaths officially confirmed.
Years of training, but nothing could have prepared them for this. Every few minutes, there's a new patient.
For many of us, it feels like we're starting to emerge from the global coronavirus pandemic, a pandemic that shut down entire countries and continues to do so. It put enormous pressure on healthcare services and meant many working in that sector had to develop completely new systems.
Physical-based care moved towards virtual-based care overnight, right? Thankfully we were well positioned here because we were doing a pilot for a very large French insurance company within Southeast Asia, where we had developed telemedicine in India to cover migrant populations in Southeast Asia. So this was just a pilot that we had set up. We had set up telemedicine even prior to COVID. And when the pandemic hit, we already had the clinical care protocols. We already had the care pathways in place. We already had physicians who were basically set up on the telemedicine infrastructure. So in that sense, hindsight is 2020, because we were well positioned to make that pivot from physical health to virtual care very quickly. And what started out as a COVID-based helpline or COVID-based virtual care soon transformed into a full-blown virtual concierge care assistance that we were providing for large enterprises and organizations.
Being adaptable and digitally savvy are the key strengths of Elwinder's business model. So how would he advise other young people looking to get something started and build a brand?
So two things, right? I mean, one, I don't think that there is a perfect moment to start something. So if you do have an idea that you're passionate about, if you do have an idea that you want to pursue, I think you should just figure out how to execute it and to pursue it. And everything else will probably fall in place if you're able to do that well, right? And I think the second thing that's extremely important, especially if you're just starting out, is to try to get plugged into the ecosystem, the startup ecosystem, I mean. And at the same time, if you're able to potentially find some mentors who can potentially guide you. We did not have both the mentorship or to be plugged in initially when we first started out. But I think if we did, it would have saved us a lot of time to be able to learn from other people's experiences.
How do you think you do that then, with hindsight? How do you plug yourself in?
I think it's really easy, right? Because think about it, everyone's interconnected. So it's just a matter of reaching out to the right people who you potentially want to learn from. Reach out to them, get involved actively in terms of networking events, and at the same time, potentially get involved in potential accelerator programs or incubator programs because the right ecosystem is probably there.
You'll remember I mentioned family right at the start of this episode, but it's not just Elwinder's dad who's part of his story. The business is a family initiative. Elwinder's sister and a family friend are co-founders.
The three of us, we had various skill sets, so we were able to lean upon that. And now as the team has grown, I think we continue to learn from the team, especially because we've been able to develop subject matter specialists. We've been able to develop people who are like pioneers in their own rights, right? So I think it's been good in that sense.
Because they sometimes say that family businesses are quite hard, that it's actually quite hard to work with siblings. I don't think I'd want to work with my sisters, to be quite honest. You've got to be quite tolerant of each other, I think.
Yeah, so I think the way we've worked is we've divided our roles and responsibilities. So whilst we do work together in a sense, it's we have certain verticals that we are accountable for, right? And given the fact that we all came from a professional environment prior to starting Connect and Heal, it does help in that sense.
Do you ever pinch yourself and think, gosh, this started as just an idea because we were trying to look after Dad, and now look where we are?
Yeah, I mean, as I said, right, when we do get a little bit of time to look back and reflect, then those thoughts do come to mind. But at the same time, I think we're too busy hustling because there's so much to do in this space, especially given the fact that the speed of digitization, the use of digital therapeutics, the use of big data in healthcare and wearables and so on and so forth, and the need to basically be able to track and affect the clinical outcomes. I think there's so much scope in this space that we don't really get the time to reflect as much as we would want to. And
just finally, how's your dad now?
Oh, he's much better. He's if you ask me, he's reversed his diabetes. His overall health is very much under control. Sometimes I think he's probably fitter than me because he does 10,000 steps a day. But that inspires us, right? Because that tells us that, with the right guidance, with the right care, you're really able to make a change, right? And my dad's just one example. We have like countless patients who we've been able to help, and we want to continue to be able to touch more lives.
Well, thank you so much for joining us on Business Daily today. I feel like I need to get up now and start doing some steps. Your dad's made me feel motivated to go and get my 10,000 in. And you should do the same.
I should do the same as well. So, yes.
Elwinder Singh, founder of Connect and Heal, ending this episode of 1,000,000 by 30 on Business Daily from the BBC World Service. This episode was produced by Rory, Claydon. And for more, subscribe to our podcast.